That's not bad.
Hey guys, this is Dr. J.
This is Dr. T with Twin City Health.
And today we are bringing you guys a testimony of a kiddo that's in our office.
Ife, he's amazing. He's been with us for about 6 to 7 months now, and his mom brought him in, and Dr. J is going to tell us a little bit about his testimony.
So actually he originally came in because he's on the spectrum, and mom even said he was having a hard time with self-expression, with speaking incoherent sentences and memorized sentences at that. And now, after getting adjusted, Ife's expression has gotten a lot better. He is speaking with more spontaneous sentences and is engaging better in two-way conversation. I can't wait to see how he continues to meet his future communication goals. Ife's social skills have improved, he's more socially aware, and is responding to more social cues. He responds better to teachers, students, and mom.
Yeah, so when we take, Ife is 6 years old, and the reason we take care of kids on the spectrum, autistic kids, they have this sensory overload. And when you're in a sensory overload, that's when you're in a fight or flight system in your nervous system. Fight or flight system is called sympathetic system, where it's hard to hear all the loud music, bright lights. It really is sensory overload. Think about when maybe even an adult could relate when they had a migraine or something.
Or sometimes maybe coming into our office. Yeah. A little bit of sensory overload.
It can be because we have music and a TV.
Yeah.
But these kids live in sensory overload all the time. So it's important for things to go down to a rest and digest nervous system, and that's called parasympathetic. So by getting adjusted, we look at the top of their neck where the brainstem is and where that first bone is, and that's where you really turn on the parasympathetic nervous system. So when kids get adjusted who are in this sensory overload system, they do so well over time. Ife, I want to show you, his mom started tracking things that he brought home from school, and just a few months in, this is his name right here, I-F-E, and as you can see, it's not quite on the lines here, and then here's 2 months later, that was in October, here's in December, his name is right here, and it's a little bit more lined up on the lines, so this is the new one right here, and it looks way better. Another thing I want to show you is even his writing down here. It's hard to see, it's pencil, is more in the lines right here. So he could communicate better. He could also, his teachers noticed alone when outsiders notice. It feels so good for mom and dad. And then just to see the physical aspect of his writing, communication skills verbally, expressively, and on written on paper.
We are so excited for Ife and for any kid that comes into the office to get adjusted, because we truly believe that the best is yet to come, especially for kids when they fully get to express themselves and we get to see them grow and change and just become a better version of themselves.
And they are the future generations, so
they'll be taking care of us one day.
Yeah.
Yeah.
Cheers, guys.
Thanks for joining us. We'll see you next time.
Bye.